Mallory, thank you so much for joining us on the show today.
Yes, hello, how are you?
I am doing awesome.
Good.
So, I found you because I'm in love with your Instagram page,
Thank
and
you
we'll,
so much.
and yeah, you're welcome. And we'll put a link to it in the show notes because there's tons of great information out there for our moms. Too much for us to cover, really. But for today, I want to dig in and really just focus on the mouth. So let's start off with why is it so important for new moms to get in their child's mouth, and what is oral mapping, and what's the proper way to do it?
Yeah, it's such a weird concept. And a lot of times parents are like, that's a little strange, right? But
Right.
when we look at the mouth and really, I am all for all human beings getting in their mouths. I really push the adults of the parents I work with like to get in their mouth, right? And they can start to feel the differences in their body, which then in turn really changes their sort of mindset and how they feel about getting in their own child's mouth. But for a baby who is carrying tension, and we have that word, right, or tightness,
Mhm.
or has a restriction, or isn't using their mouth optimally, um, eh, getting in there, it's, it's like any kind of support we give these babies for head control. It's like the support we give them to sit and to roll, and we're constantly moving their body to facilitate those movements, right? And so when we look at the mouth, if you just take off any kind of weirdness that you feel about it and look at it from a muscle perspective, right? The tongue is such a big, great muscle, and
Mhm.
it's important for not just feeding, but for breathing and for digestion and to regulate the body. And we can facilitate that muscle. The oral play that we encourage, right, is to
Mhm.
engage the muscles to move and to release any tension that they might be feeling in order to function properly. And to expand that, right? When the tongue isn't doing what it should be, which is sitting on the palate,
Mhm.
shaping the face, regulating the system, then baby's brain connection to that space is limited. And when we're talking about oral mapping, getting in the mouth and building those connections, helping baby build those connections is important when we start to look at gagging, and not just when you're starting solids, but there's lots of babies who will gag on pacifiers, gag on bottles. And that is because that brain connection, they're missing pieces in that space. And getting in the mouth can help build safety within that space.
And that gag reflex, does that also, is it the same for adults? Because that mapping's just not there, or is that a different
Yeah,
subset of
so
issues?
I would say it's different.
Okay.
Interesting. It could be depending on like what activity you're trying to do, right? Like if somebody's so for adults, we're very cognitive, okay?
Mhm.
Babies are more reflexive, right? And so like right now you could think of something really gross, something that you can't stand, and you could make yourself gag, right?
Sure.
Because
Yeah.
it's not just a physical thing, it's emotional too.
I'm
And
thinking about, like,
so,
brushing your teeth, or when we go to the
yes.
dentist, some of us
So when we
gag.
look at things like that, right? Like, is it because of your perceived notion of um the activity itself? Like some people just don't like the dentist, right? Or is it because your body is carrying tension in the back of the tongue, and your brain connection lacks awareness of that space and doesn't feel safe, right?
Mhm.
So even for adults, if you struggle with brushing your teeth as an adult, or if your child struggles brushing their teeth because they're just excessively gagging, we have to look at why, because that gagging is physical, but it's also psychological, yeah. And so
Sure.
do you not feel safe in that space? Is your gag reflex hypersensitive because of that?
Makes sense. And it's
It's
such a huge
interesting.
one to, it is. And it's such a huge, though, this is a, you've touched on it. And again, I encourage people to go to your Instagram page. But before we move away from this topic, you mentioned the brain connection. I don't think we talk about that enough. And I think that's
Yeah.
really important for parents to hear because no one told us, you don't think about it, that
Yeah.
one of the best ways you can help your child's cognitive development is, having that tongue in the roof of their mouth and having a good airway and sleep pattern.
Yes. Yes. I mean, so like not just brain connection for awareness, right? Because if there's a part of your body that doesn't get touched, right? Like that's
Mm-hmm.
anywhere in your body and doesn't get moved and doesn't get a lot of input, any new touch to that area is going to be sensitive, right? Like your
Sure.
brain's like, "Whoa, what
Yeah.
is
What's going
that?"
on? Yeah.
Yeah. And so if your tongue is sitting low in the mouth and that palate is always wide open and it's never getting any kind of input, if you're going into space that never gets input, then your brain is going, that's a defense mechanism. Gagging is for
Mm-hmm.
safety, right? And we need to help create that safety in the body. But also, right, like the turning the brain down, because that's what the tongue is doing when it's on the palate, is bringing it into the
Mm-hmm.
parasympathetic nervous system. And
Right.
so if you're never there and your brain is always on, gosh, that's exhausting for your body. You can't function if your brain is constant. That's like not going without sleep. And that's when we go into what's the quality of sleep versus the quantity of sleep, right?
Mm-hmm. And if you're constantly in that fight flight and you're not sleeping, now
Yeah.
we're getting into things like ADHD and other behavioral issues. It's
Yeah.
really just a can of worms that
Yes.
I don't think from the outside world, you don't put them all together.
Yeah. No, right. We're always separating. Like everything
Mhm.
is its own thing, right? And that's not,
Right.
the body is all
That's not how the body
integrated.
works. Yeah.
Correct. No.
Yeah. So let's talk a little bit about breastfeeding because this is a huge topic. And before we dig into this, I just want to caveat it with if you're a mom that wasn't able to breastfeed and your child is older, like mine, go ahead and take your mom guilt and let's put it to the side as we continue this conversation. I,
For sure.
I, w- I wasn't able to. Had I known then what I know now, probably could have.
Yeah.
But so we know breastfeeding is important for a plethora of reasons. It's just
Yes.
if you can, it's great. But you actually discussed some optimal bottle feeding techniques. So when it comes to bottle feeding, what bottles and nipples do you most recommend, and what are some of the techniques you recommend?
Yeah. So this is a big hill that I stand on because we all get it. Breastfeeding is great. And I do both. I breast and bottle feed my babies. So this is not a debate whether which is better, breast or bottle. Yeah. But we
Right,
can't continue like the rhetoric that all babies who bottle feed are going to have these oral motor deficits like that. Like
right.
we need to move past that and start supporting better oral motor development for these babies. And so when we're looking at bottles, you can just ignore anything the box says because bottles are not regulated and a company can say
Mm,
whatever they want about their bottle. Nobody checks into that. Nobody says, "Oh, well, this advertising is 100% accurate," right? So all the boxes that say most like breastfeed, we're ignoring that because it's
okay,
probably not true.
just marketing. Yeah.
Yes, it's just marketing. And the fact is that there's no bottle, not a single bottle that will ever mimic a breast. A breast is tissue. You can't you can't do it. It's not going to
Yeah.
happen. It functions in a completely different way than a mechanical device, right? But what we're looking at is how we're feeding baby. Are we being responsive feeders with the bottle? Because traditionally we put baby in a cradle hold and the bottle pops in and they're just guzzling down, right?
Right.
But when we look at responsive feeding, we're taking that away from the baby. We're waiting until the bottle is empty. We're not listening to their cues. We're not even paying attention to it. So outside of like the bottle, how we're feeding baby matters. When you're looking at the bottle itself, and I have some because I have tons of
Okay.
bottles. We want a sloping shape. Okay.
Okay. Instead
So,
of the one that's kind of back curved in and then pops up.
yes. Okay. So then you have, let me see if I have some around here. So this is a ma'am bottle, which everyone
Hmm.
knows, and it's the flat nipple. Okay. And now I also tell moms, it is not if your baby drinks out of a sloping nipple, it doesn't mean there's not going to have any motor deficits. And if your baby drinks out of a MAM, it doesn't mean that they will have deficits, but it does tell us something about the body. Because if your baby cannot drink out of this kind of nipple, but they can this one, it tells us that they're having trouble with latching. Okay. Because the
Mm-hmm.
nipple is flat. They don't have to
Right.
latch around the nipple. They just rest on the tongue and then they munch on it. Okay. So your baby did wonderful on the ma'am bottle. That's great. I'm never going to tell you stop giving them the ma'am, right? Because our number one goal is baby be fed. But I do
Hmm.
want to encourage that we're looking at the big picture. So
Okay.
if we're not interested in changing feeding, what else is going on in their mouth? Are they breathing with it closed and nasal breathing properly? Like that, we need to mark that
Mm.
off. Are they sleeping? Do they wake up well rested, or are they waking up cranky, tired, and mad? Then we're looking at quality versus quantity, right, of sleep.
Right.
So there's other things that we can look at. But the other popular nipple, which is I'm trying to show you, but I'm not seeing one right away. It's going to be like your standard wide neck nipple. So it's going to come up and then it's going to shoot up, right? Man,
Okay.
I wish I had
We'll put
one. This is
we'll put
videoed,
links.
right?
Yeah, we'll put links
Um,
in the notes.
and Okay, so your
Oh, gotcha.
traditional
Yeah, yeah.
wide, it's going to look like this, right? So it's got a
Yeah.
big base and then it comes up into a nipple, right?
Hmm.
And when we talk about like most breasts, like we don't want when you're breastfeeding, we don't want lips like a smashed nipple, right?
Hmm.
And the Nook bottles look like a lipstick nipple. Well, we don't want that when we're breastfeeding, so it's just so strange. Anyway, so this is like your traditional wide neck, right? And so there's
Okay.
what, like 20 different bottles now that look like
Oh, at
this in
least, yeah.
some way, shape, or form.
Hmm.
Um, and what this does is really creates a narrow latch. Okay, so baby
Okay.
is not widening their mouth on this piece, which is what we're wanting. We're wanting a deep, wide latch, but they're not getting to this piece. What happens when they get to this piece is they push up against it, right? So their lips
Mm-hmm.
go on top of that wide piece instead of really flaring out. And so now we
Gotcha.
have a really shallow, kind of narrow latch. And how hard is that to drink from, right?
Right.
Um, the other thing that could happen with these wide bottles is that they latch on. And if they do get a wide piece, but look at all that air that's in
Hmm.
between the latches, right? So you're latched here and then you're latched here. And we have this middle hunk of air just pulling in air. Yeah.
Right. Yep.
So when we're looking
Which
at
leads to a whole
what,
other issue.
yeah, yeah. So sloping, your sloping nipples are even flow balance, um, pigeon, Lancino, and they have a couple of others, but they'll all look like this.
Okay.
Um, the other thing that helps with feeding is like the texture of the nipple. Okay, so like you can see, this is very elastic,
Yeah.
and this would be considered more breast-like. However, what I find is that because this mimics the outside of the breast, there's nothing inside that's mimicking the breast tissue, right? So
Hmm.
when baby
Right.
is pulling on this, um, I find that baby kind of struggle with the softer ones because when they're
Hmm.
pulling, there's nothing for them to push up against. Then it almost flattens
Oh
and then
yeah,
they're
I
pulling
see.
against it.
Yeah. Okay.
So, so while we want a good wide shape to help latch, right? For the tongue
Mhm.
to cup, for the palate to be nice and wide and not narrow against something. Um, when we're looking at the texture, I want it to I want it to be a bit firmer because that
Okay.
firmness, while they have a nice pretty latch, that firmness gets them something to push up against, if that makes sense.
Yep.
Um,
Yep. So they're actually
so
that would make them work their jaw more, right? Which is
yeah, I
what we
mean,
want.
yes, we want them pulling, right? And while
Hmm.
it looks nice in
Yeah.
action, it kind of defeats the
Still miss the mark.
purpose. Yeah, yeah, it's
Yeah.
missing something. Now, a lot of babies do well on this, and there's benefits to this kind of bottle, because you are getting that shape that you like, and
Hmm.
maybe a baby who is low tone might do a little better on something that doesn't need as much input in order to suck, right? So
Hmm.
you're kind of looking at again at baby holistically versus just like this is the one bottle that every baby needs to use. Um,
Right.
Even flow balance will is still my favorite bottle ever.
Wow. Okay.
So, and I've
All right.
tried a lot.
Yeah, I'm sure. Yeah. And so how if we're using the bottle, how can we prevent overfeeding?
So we have to look at position, right? Because that
Okay.
matters because you're going to miss baby's fullness cues. If we're in cradle and we have the bottle down,
Gotcha.
babies in the crook of your arm, you're missing their cues. And a lot of times parents are missing their
Oh,
cues because they're so worried about baby finishing their bottle.
right.
If we want
Especially
to
if it's your
prevent,
first baby, right? Because it says
oh,
they need this much every time, and you're
yes,
just going by that list. Yeah.
even the cans of formula say 0 to 1 month should be drinking that. Like
Yes.
from birth to
It's a
1 month,
guide, right?
so
It's not the
much.
law. It's a
Yes.
guide.
Gosh,
Yeah.
and it's so frustrating though. And to be like a new mom and like you read the can and you're like, well, my 1 day old isn't eating like this. Well, your 2 day old is not going to be eating what a 1 month old eats. Like that's such a
Right.
big jump. It's so crazy to
Hmm.
me. So first, like we need to understand that finishing the bottle is not the goal. Yeah.
Right.
Like we
Right.
always have an idea about where we kind of want to sit with ounces. Um, but finishing the bottle isn't the goal. And a lot of times we're missing baby's cues because we're paying attention to how much of the milk is left.
Hmm.
And so yeah, if your baby is in cradle, let me grab my baby. If if you're here, like in our traditional cradle position, like
Hmm.
baby has really limited movement,
Right.
and you have a bottle pressed up against their mouth, right? Like
Hmm.
they're not going anywhere. And so if they wanted
Right.
to turn away to like say, "Hey, I'm full,"
I'm full. They
we're
can't.
not
Yeah.
seeing that. Yeah. Um, so we want baby to be in a sideline position. Okay.
Okay.
This goes for forever. This is not a medical position. This is not a position that you use when they're young and learning. We always want them in this position, however you want
Okay.
to do it. Okay. So parents can have them on their legs out like this. They can put a
Hmm.
pillow on the sofa and feed them. They can lean up against them like this. Okay.
Those little boppy pillows,
So they're
popping
like
pillows. Those are great.
elevated.
Yeah.
Yeah.
Okay.
And they're on their sideline, right? What
Right.
for and as they get older, they'll end up sitting up. Yeah. And then you're just
Hmm.
sitting them up
Sure.
and feeding.
Right.
Okay.
But they would have movement at that point.
Yes,
Yeah.
yes. And the bottle is always horizontal. We're always
Okay.
horizontal, right?
Okay.
This should be a 90-degree angle.
Okay. Got it.
Um, and so this would be fine as they get older. I don't like the sitting up position when they're young because we don't have this core strength. And so then they end up like
Mm.
this, right?
Right.
And that
Yeah.
is so much pressure on
Hmm.
that esophagus. So when we're talking
Yeah.
about reflux and discomfort during feeding, I mean, that's like you wearing a tight pair of pants to Thanksgiving, right? And you just got to like
Right.
open it up when
Exactly.
you leave. Um, so for overfeeding, right? Like to get all the way back, we go in a big circle. For overfeeding, we need to have baby able to tell us their fullness cues. And we
Hmm.
need, so them turning away, right? Them slowing down. A lot of times when they're here too, we don't even notice the slowing down because they have to keep sucking
Yeah.
because the milk is just coming, right? Whether they want it
Hmm.
or not. So we're missing those two big ones. And then stop paying attention to the ounces. Now, of course, we want baby eating, but if they're stopping and they're showing you that we need to stop the feed and they're not getting what they need to based on them not growing on their own curve, right? If you are born in the 30th percentile, it's totally fine for you to stay in the 30th percentile. You don't need, it's not a test score. We don't need to be all 100th
Right. And you don't
percentile,
compare
right?
them to what the 90 is
No,
eating and doing. It's
correct.
completely different.
It's
Yeah.
completely different. And so if your baby is really lethargic or they're not having a lot of pee and poop diapers, like if they're truly not getting enough, but they're telling us they're done, we need a feeding assessment. That's telling us something's going on and we need somebody to look at it, not that we need to push ounces. Like that's not the solution. Because
Something
then we
else
have
is
a
going on.
baby.
Yeah.
Yeah, we have a baby who's refluxing all over the place. And then what? And then it's
Yeah.
just a whole nother problem.
Right. Right. And again, if you want to dig into this more, I encourage everyone to check out your Instagram and put your mom guilt out. Because I'll tell you what, in this
Yeah.
particular subject, because my two were so different. I mean, they were both
Yes.
tiny little Polly Pockets, but the way they fed was so different. And watching your Instagram, like I said earlier, man, if I had just known,
Yeah.
because my youngest had issues, and we had to switch her formula and we do all these things. But wow, if I had just laid her on her side and done a couple of other items that you touch on,
Yes.
what could have
What would have
happened,
been
right?
different? Yes.
Yeah. And it's not just stressful for the mom, it's stressful for the baby.
Yes.
So now we're back into that parasympathetic mode. We're all
Uh-huh.
stressed and walking around just all the time.
Yeah. And like hating feeding time. Like the
Yeah.
countdown to when it's feeding time is like you can feel the anxiety building up in the family dynamic, right?
Right. Because you know
Yeah.
what's going to happen when it's over. There's going to
Yes.
be spit up, there's going to be colic cries, and there's going to just
Yes.
be anxiety, and it's not fun.
Yeah. It's
Yeah,
rough.
it is. But and we'll also put a link for those that would like to get in contact with an IBCLC, that the national link where you can go find
Yeah.
somebody in your area because it's huge, and it can make a huge difference for you. One of the things you talk about is cranial sacral therapy. And I know if for those who haven't heard it in some of our other episodes, could you just briefly describe what it is and how it's beneficial to babies, especially the
Yeah.
the teeny ones?
Yeah, sure. So craniosacral, so I'm a speech pathologist by like trade, I guess you would say. That's what
Hmm.
my master's degree is in. But when I found craniosacral therapy, when I became trained in that, it changed my whole career, and the way that I help these babies. So craniosacral really is about energy, and that might sound very woo-woo. But I always like to encourage people, like on a very base level, is to just like imagine the worst person that you know in the world and how they physically make you feel. You don't even have to touch them, and like the physical change your body goes through when you think of them, right? That's
Right.
energy versus
Hmm.
the person you love the most, and how you relax and your whole body physically changes. And
Hmm.
so, whether you believe in energy or not, it's impacting you every single day, all day long. And so, craniosacral therapy really is about uh, me as like the therapist, and you go into the body and you're using their own rhythm. So I find their rhythm and their energy and how they're responding within their environment. And we sort of release where they're holding on to any kind of tension or trauma. Um, Surprisingly, like 99% of the time, whenever I tell the parents, oh, I'm feeling most of their tension built up here. And I go to this one spot of the baby. It is always where the mom or the primary caregiver feels the most tension in their body. And
That's wild.
I know, I work with a pelvic floor physical therapist, and sometimes we do co-treatments. And I'll be working with baby, and I'll tell a parent at the end, this is the side and body part I want you to focus on when we're looking at movement to help build safety in their body. And the pelvic floor therapist is like, well, mom, this is the side and spot of your body that I want you to focus on. And the way that they match and mirror each other is just, it's like
It's
beautiful.
wild.
And
Yeah.
yeah, I tell parents all the time who are like, well, where do I start? I was like, well, where do you feel the tension in your body the most? That's where I would start with your baby because there's just so much correlation between the two. And so craniosacral is like the lightest touch ever. It's 5 grams of pressure. And so if you have like a food scale, you could like go put 5 grams and it's just like the lightest touch.
Mhm.
Um, but what it's doing is transferring that safe and um, that energy, releasing tension. We're going into the body and finding where they're at um, and helping them move. You might also hear of cranial fascial therapy,
Mhm.
and that is like a more movement based, while cranial sacral is using lots of energy and soft touch to go into the body. Fascial movement uses a lot of physical movement, right, to release fascial tension, because tension can be physical. So we can
Mhm.
physically move it. You see, I know all those people have seen those videos where they're like rubbing on the adult's back and it
Yeah.
turns really, really red, right? So they're
Right.
releasing fascial adhesions. Um, we're not doing that on babies.
Right.
So, so fascial adhesions can be physical, but they can also be energy and emotional based. And so I kind of use a combination of the two because I am a speech therapist and I do manual therapy, right?
Mhm.
Um, so you might go to a cranial sacral session and they're literally like just the lightest touch moving around on baby's body, and releasing tension within. And then you might go to a therapist, like speech or occupational or physical therapist who's also trained, and they might include some bigger movements with their treatment. So it can look a little different from provider to provider. Um, but for babies, it's a beautiful thing because they're, again, like I said earlier, adults are so much more cognitive that they put
Mhm.
all of that awareness and what they know on top of those emotions, whereas babies are not that way. And they are so open to being free and letting go. And I love treating babies because they tell me right away where they're hurting, and we go there and we can treat it and we can release it. We see progress, we continue that, right? Um, for adults, goodness gracious, sometimes you gotta
Yeah.
like,
It's an uphill battle with us.
that's a lot of onion we're peeling back for adults.
Right.
Like, and they have to be open and willing, and for babies, they already just are. So if you are struggling with attention patterns, like your baby always looks one way, or they're having constipation, or they're having feeding difficulties, like we're getting the feeding assessment, right? Um, but sometimes unfortunately, those feeding assessments just aren't, they're not looking at the whole baby. And sometimes they're looking at, they watch baby eat and they're like, well, it looks okay, but they're not feeling baby. They're not getting in the mouth. They're not
Mhm.
feeling their body. They're not building the connection with where the breakdown is. And, and so like get the feeding assessment, but they have to get in baby's mouth, right? Like you,
Yeah.
you can't do a feeding assessment without getting in the mouth and feeling the muscles and learning what they're doing. And so
Mhm.
many parents get feeding assessments that are just not, it's just unfortunate and it's sad because,
Yeah.
as professionals, I'm like, get the assessment, get the assessment. And these poor parents are getting the assessment and it's just doing nothing.
Right.
So it
Which is
can
why
be
we want you to go to a
frustrating.
certified
Yes,
IBCLC because there is a
yes,
difference. And hands off to the nurses that help us in the hospital right after we have the baby,
Yes.
but they aren't trained the same way
Yes.
this group is. And that's why we want you to go to this group.
Yeah. Yeah, for sure. And even like when you're looking at therapists, you know, like out of school, I can treat feeding disorders as a speech pathologist, but the amount of training and extra training I did for infant feeding, it just is way different. And
Yeah.
it's not the same. And so I always encourage parents, if you're calling like a therapist group, do you work specifically with infant feeding? Because you can
Mhm.
work on feeding disorders, but a 2-year-old feeding disorder is way
It's
different than
very
a
different.
newborn.
Yeah.
Yeah.
Yeah, for sure. And before we
I
get
just
off this
went, I
topic,
just went all, yeah, I went all the way around. I don't even remember what the question was.
no, you did. That was awesome. We covered a
Okay.
great deal, and that's awesome. But before we leave craniofacial or cranial sacral, rather, I just want parents to know I'm going to put a link in the bio or the show notes rather that to Dr. Stephen Hall's book. He also was I think our second or third episode, and
Okay.
if you haven't checked it out, he does a great job explaining it. And he's up in Seattle, and this is what he does. And it is, I'm saying this as somebody with a science degree. It's science backed, and it's not
Yes.
complete woo woo. It's
Yes.
fascinating, absolutely fascinating,
Uh-huh.
and worth exploring. Yeah, it's
For
life
sure.
changing.
Yes. Life changing for sure.
It really, really is. So, okay, now let's talk a little bit about nasal hygiene,
Okay.
because especially as new moms, we all got that little sucker in your go home
Yes.
kit, right? And
Uh,
I think we spent like 15 minutes on it during our prenatal classes, but there's so much more to it. So,
yeah.
really, what is nasal hygiene and how does it relate to and why is it so important for oral development?
Yeah. So you are meant to breathe through your nose only.
Right.
We are not meant to be mouth breathers. The nose has certain systems in place, right, to filter air, to um, aid in your health. And
Mhm.
so, your chronic mouth breathers, when we're looking at upper respiratory infections and things like that, it matters. And so, nasal hygiene is simply, it's like brushing your teeth. And sometimes, they're like, well, I don't brush my infant's teeth. Well, you should.
Mhm.
Like getting a little washcloth and wiping the gums down, there's I'm a proponent of that. And so the same goes for nasal hygiene. We should be doing that daily. Um,
Mhm.
you can those little saline nose drops, right?
Yeah.
Um, you drop them in. The big piece that people miss though is that we want baby to be swallowing we want it to be going down the whole airway
So,
tract
yeah, it's got to go the whole way. Yeah.
the whole way. And so when you drop those nose drops and then we suction it, it just
You've missed the
defeated the whole
whole back.
purpose.
It needs to go all
Yeah,
the way back
it
and
needs to
down.
go
Yep.
all the way back because that is a big space.
Yeah.
And so we're dropping those drops, and if baby can be, hanging off the edge of your leg, right? Just a little
Mhm.
incline, and you drop them, and you just wait a couple seconds, and you will see them swallow. It's really interesting thing to watch. And
It's
so,
trippy because you don't think about there's a hole back there. And as
uh-huh,
somebody that gets scoped frequently,
yes,
I'm used to it now, but the first time they go up and back and you're realizing, wait, you're in my throat. You came this way. It takes you a minute to go through biology and connect
yes.
and realize you thought it was like this, but there's a hole back there.
Uh-huh. It's a whole
Yeah.
cavity.
So just
Yes.
let those drops go all the way back because there is a lot of space back there
Yes.
that your
And
Kleenex you're just not getting.
correct. That it's true.
Yeah.
And your suction and on
Oh,
the
that's
other
little
side of
sucker
that,
can't get back there.
the
Mm-mm.
sucker's not getting back there. And the sucker also, I mean, that's a lot of pressure in the nasal cavity. And so I tell parents, if you don't see snot and if you can't get it with your finger, don't use it because you're putting a lot of pressure in that space
Mhm.
and it can cause inflammation into the tissues if you use it too much.
And it's
And
scary.
so yeah, it's intense.
It's scary. Yeah. For a little person,
Yeah.
it's unnerving for them.
And a lot of times, they're doing the nose drops and then they get the sucker And what babies are doing is they're linking those drops to the trauma that's about to happen with that
Mm-hmm.
sucker.
And so
Uh,
now we're tense and yeah.
and, and then in all reality, like the drops itself are fine. They don't mind the drops.
Mm-hmm.
And so using use the drops by themselves. Of course, the sucker is there when you need it, but it's not most of the time it's not. For our babies with reflux, when they are refluxing, it's going into that giant airway space. Okay. Um, and so I always encourage parents when a baby refluxes or you hear them reflux, give them a little support in that airway and do a little nasal hygiene, help them clear it out. As your kid gets older, like I teach my kids do their own drops now, but then move their head around, right? Because
Mm-hmm.
that space is wide in there. So
Big.
get that
Yep.
drop, let it slosh around in there, right?
Yep.
And then it can be really clearing
You're
out your
basically
spaces
gargling.
better.
Yeah.
Yeah, yes.
Gargling through your
Yes.
nose, right?
Gargling your nose. Yeah, exactly. Oh,
And
I
I've
love
I've seen you
that.
talk
I'm
about
gonna
that.
steal that.
Do it. It's all yours. And I've seen you talk about this, but I want to make sure you say it on here. Neti pots.
Uh-huh.
Hmm. How you feeling about a neti pot? I'm just watching your face. I already know the answer, but let's talk about neti pots because we hear a lot about them.
Yeah, I think that it's pretty much like a suction device, right? Because it's only getting now you see these videos where just so much snot comes out.
Yes.
And it's
Yeah.
pretty intense. It's intense. My goal is to never like put that much stress on a little human.
Right.
Um, and I don't uh, I want to keep this area safe, if that makes sense.
Hmm.
Uh, they're intense. That's all I can say. I'm not going to tell you that you can't use it. And if you've been using them and you love them, I can't say, stop.
Right.
But
There's
but
a better.
like, yeah, there's a better way. I would say
Yeah.
there's a better way. And in a very more non-invasive way. And that's a lot for me to say because people are like, well, what you do in the mouth is so invasive, right? And I'm like, so
Yeah, but it's not traumatic. You're not in
it's
there banging
yes,
around and giving them
exactly.
huge sounds and pressure, and it's different.
Yeah. It's the
Yeah.
pressure that really bothers me. And
Hmm.
um, I mean, of course, I've had it done to myself because I never do anything to my babies that I don't do to myself. Um, that includes like what they drink and what they eat. Like I've tried all the formula because
Yep.
I want to know what their experience is, right? Which
Hmm.
you can't really know because everybody's experience is different with everything. But in terms of like how it feels in your body, it's just so intense.
Yeah.
Um,
And I have to say, in all fairness, I think we've all tried the formula and the breast milk. So let's
I
all
mean,
just
yeah,
come out and admit it. We've
like,
all done
I
it. It's right. Your
mean,
first kid, you're curious, you're there, you're tired, you're like,
yeah,
let's see.
let's just
It's fine.
see.
And I tried a neti pot and I assumed it was because I'm just freakishly skittish about that stuff. I mean, to
Uh-huh.
me, that this is an outie, right? Things come
Yes.
out. This is not an any hole. So I was already freaked out to start.
Yeah.
So in all fairness, I probably am not a good candidate. But yeah, that's not a good one for me. But the
You put
drops,
that, like you
the
put that psychological bad
yep,
already on it.
exact. But the drops, it's fine.
Yes.
Drops are fine.
I will say too though, spray it can even be intense. Okay.
It
So
can, and that took me a while to get used to. But now I'm
yes.
okay with spray. But
Okay.
the neti,
Just to put that
just
out
say no
there
for me.
for children, for babies, I I would not do a spray. Goodness
Oh my
gracious,
gosh.
they're so
Well,
intense.
and they have to learn spray. Yeah,
Y-
that's hard to teach a tiny
yes.
person,
Yes.
right? That movement, that little dance
Yeah.
you have to do, because
Yeah.
otherwise it's just
Drops.
coming out.
Uh-huh.
Oh yeah. I think we've all experienced that as well, just watching it drain.
Oh yeah, yeah. I don't.
Parenthood, it's
It
fun.
the net. Yeah, I don't know. I mean, a lot of times people are like, if you do it on your baby and they're calm and they're fine with it, then keep doing it. Anyway, that's
Yeah.
my thoughts on it.
Yep. I'm right there with you. All right. So now let's talk about the ears.
Okay.
because we know that the ears are going to impact the child, especially with their, state of relaxation. And somehow you can ease digestion with this. But again, it's on your Instagram. That's why I knew to ask this. But let's talk about that so parents know what that looks like. And this is another tool they can have in their toolbox.
Okay. So the ears are, I love the ears. Okay. The ears don't get enough credit. And when we're looking at the ears, and like the spaces in the skull, right? They're connected to the throat too. And a lot of
Yep.
people don't know that. And so when I talk about feeding and the tongue and the ear connection, it's huge. There's literally like the elevation of the back of the tongue is how you can drain the ear.
Hmm.
There's a muscle like responsible for that. And so when we're talking about a baby with low tongue posture and they're never elevating the posterior tongue because of tension or because of a restriction, we're getting those chronic ear infections. And what I
Hmm.
love about making this connection for people is because so often bottle feeding gets blamed for chronic ear infections when really
Right.
babies moved to the bottle because they couldn't breastfeed. They couldn't breastfeed because they had oral deficits, right?
Hmm.
Now they're getting the ear infections because they have oral deficits. That has nothing to do with them using the bottle, right?
Right.
And
Because
that
we've all
just,
heard that if they're laying down, don't
yes.
give them a bottle, they're getting ear infection.
And that, no. And,
Yeah.
and it just, it's mind blowing for some. And it really helps build that connection between what happened right at the beginning and sort of how things can snowball into their own individual issues
Hmm.
when it's one big issue. Like
Right.
it all goes back to what was happening
It's
with
all back
baby in
in
the
the mouth.
beginning.
Yep.
Yes, in the
Yep.
mouth. And so with that connection, like with the tongue, right, and feeding and function of the ear, y you get like this connection to the jaw too, right? Like they're stacked on
Yep.
top of each other. So if we're having tension being pulled here, when we're looking at babies with torticollis, imagine all the tension being pulled on one side. What is that
Hmm.
doing to the function of the ear? So then why does that matter outside of ear infections? Well, then we're looking at the vagus nerve. And the
Yep.
vagus nerve, we know is stimulated with palate input, right? That's why the tongue needs to sit up there. But there's a branch of the vagus nerve that we can reach through the ears and input in the ears. And this is why, this goes way back. Acupuncturists have been doing the ears for as
For
long as
millennia.
the
Hmm.
world has been here. Like
Yeah.
the ears have always been there. They've always been a gateway into helping the body calm. And so getting in the ear, when I say get in the ear, we're not putting our finger in the ear, right? Your
No,
finger's never
that's
going in the
dangerous.
ear. Nothing goes in the ear. Your Q-tips that you love, like those shouldn't even be going in the ear.
Again,
And
this is an
so,
outie, not an innie.
yes,
So nothing in
yes.
there. Yep.
And so when we're talking about getting in the ear, I'm talking about energy, I'm talking about placing movement there and just give it some movement. You will see how, like, I've had adults, of course, every time I post something for babies, I love the adults who come back and say, "Oh my God, I did this on myself." You should absolutely do it on yourself. There is
Yeah.
nothing I give you to do to your child that you
That you
shouldn't do
can't
to
do for
yourself
yourself. Yeah.
first because you absolutely should. I want you to be able to feel. I give face massage all the time. I want you to feel what it's doing before you do it to them.
Hmm.
Absolutely. And so when you're doing the ears, if it's painful, that only tells me that there's tension somewhere in that space that needs to be resolved. Go lighter. You don't have, we're not going to pain here, right?
Right.
Movement shouldn't be painful. And you should be able to move your body without pain. In all parts of your body should
Hmm.
move without pain. And when you move and there is discomfort, that's telling you, hey, pay attention to the
Something's
spot
wrong.
over here because it's not optimal. And
Yeah.
so I love working in the ears, and babies will melt when you move their ear. Adults will melt when you move their ears. Um,
It's
and because
soothing.
it's that
Not gonna
connection
lie. I've
piece.
done it after
Yes.
some of your videos because especially too, I used to have pain back here. When I would
Yes,
touch it, I couldn't touch it. I would jump.
correct.
I can touch it now.
Uh-huh. And people will come back. Well, when I touch it, it hurts so bad. And I'm like, well, then you should sit in that space a bit because it
Yeah.
should not hurt. There is
Hmm.
nothing that should hurt from touch.
I had that
Like
for
you should
years,
not touch
years,
any
and
part
just
of your
one ear.
body.
Hmm.
Yes.
Yep.
Isn't that amazing?
It is amazing. It's wild. It really is. It
And
is.
so I always, I mean, I love the ears, and you just go start with the lightest touch ever because again, babies are so responsive and they will tell
Hmm.
you everything you need to know about them.
Yep.
And you could touch any part of their body. I encourage parents to lightly go across their baby's body, going down their spine. And if you see a twinge, don't ignore that. They are
Something's there.
telling
Yeah.
you something's there. Sit in that spot. Give it some movement. Go lighter if you need to go lighter. But movement is a response telling us that we need to pay attention.
Mm-hmm. Hmm. And it's funny too because they all have different touch points. Not the right word. I guess soothing spots.
Yes.
And it's funny to watch them change too because, for example, when my youngest
Uh-huh.
was little, I don't even know why. I was just messing with her feet one day, and it's like this kid turns to jello.
Yes.
And so I figured out, well, that's your spot. Well, now she doesn't like her feet touched, but it's like, wait a minute.
Uh-huh.
When you were a baby, it was like you could instantly just soothe
Yeah,
this kid.
yeah,
But it
yeah,
wasn't the same for my first one. Her place was different. I mean, everybody's is,
yeah.
and they are, and
Because
like you
everybody's
said,
different.
just watch them. Yeah, watch them. They will tell you, this is it. This is what I
Yes.
like. This is what I don't like.
Yeah,
Yeah, they're wild.
or yeah, the opposite too. You'll feel them sort of melt into that, like you touch and they sort of just like melt
Exactly.
into it. And you're like, whoa,
This is
okay,
where
well,
I
you
soothe
like
you. Hmm.
that? Yeah,
Hmm. And it's just the
exactly.
feet. And literally, all I would have to do is just put my thumb, top of their foot here, the thumb on the bottom. I'm not even putting pressure. And that's all I would do.
Yes.
And she was just asleep.
y-
That was it.
Yeah.
She was done.
No pressure, right? You're using
Yeah.
craniosacral therapy. You
And
were a
I didn't even know
craniosacral
it.
therapist. You didn't even know
Right.
it.
Right. And it's funny, doing these when we're talking about, the spaces and how it's all connected. You remember we were all in high school and you always had that one kid in class going, when will I ever use this?
Yeah.
Parenting, my friend. This is when you're going to use your biology right here. Parenting. You had no idea.
You had no idea.
Right. All right. So now let's talk a little bit more about oral movements because you have on your Instagram, and the fact that I've mentioned this like 15 times should be a cue to parents. Please go. But you talk about oral movements or this oral plan,
Yes.
specifically around the wake up routine. So let's talk about what is this and what are the benefits?
So I like a wake up routine. Some people really hate that because, I don't, I don't know. The wake up routine that I talk about is just to get awareness, right? Okay,
Mhm.
so when we've been sleeping, like, what do you do when you wake up? You move, you stretch
Mhm.
your
You
body,
stretch.
you
Mhm.
yawn, right? That's to open up that jaw. You
Mhm.
go, and then you go what? You brush your teeth, you eat, you start talking. Babies don't do that. And even as adults, um, like having an oral movement routine as like you go brush your teeth and then you learn some of these oral movements that are in the guide, parents have come back and been like, it's been life changing. I didn't even know I had tension in my jaw until you
Mm.
start to release that tension and you feel better, right? And so for babies, all we're doing is providing them that movement to help function. Uh, because these are all muscles. The tongue
Yeah.
is a muscle, the cheek is a muscle, the lips are a muscle. And for any muscle in the body, movement helps function. It's
And
that
your tongue, by the way,
simple.
goes all the way down.
All the way back.
Mhm. It's connected though all the way down so that
Oh,
yeah. And
yes.
people
So your
don't
tongue
realize that.
muscle
So
ends here, right? Like the
yeah,
muscle itself. Your
your
fascia, right?
fascia. Hmm.
Which is this connective tissue that lays over your entire body, but they have fascial lines. And this one piece of like interwebbed fascial tissue is starts at the tongue and goes all the way down, goes through your diaphragm, through your stomach, right? Through your hips, down
Hmm.
to your knees, into each toe, like down each leg into the toes.
Yeah.
So it separates and then goes down. And so that is one line, right?
Hmm.
And so when we're talking about like waking up, giving movement into that space will only help release,
Feel
right?
it everywhere.
You
Yeah.
can feel it everywhere. Um, it's just a beautiful thing, and it's so easy to do. And once you get comfortable with it, like some parents are just like, I just don't feel comfortable putting my finger in it. It just feels so invasive for them. And I would say to that is like, one, do it on yourself because I think that it will help you feel the
Mhm.
differences. And I think that that's important. But two, watch your baby. They will tell you if it's too invasive for them, right?
Mhm.
And if they are telling you, like, stop, then we need to pull back. We need to look at their movements. We need to make sure that they're not holding tension somewhere. Maybe they're
Right.
telling us
'Cause
something,
something's
right?
going on. Yeah.
Yes. So like if you're in the mouth, I love doing like when my baby wakes up and we wake up and we go in, it's she's laughing and she's smiling and we're engaging and she's starting to move the tongue and you can see it wake up and you can see it sort of like, okay, I'm ready to go, right? Because
Mhm.
what do we then do? They want to eat. And so
Right.
I want to give them some movement, release some of that tension because they've been sleeping like this
Mhm.
all night
Mhm.
long, right? So
Right.
they're trying to open up that line. So let's
Mhm.
help them open up that line all the way down to the toes. It's just, I love it. And when I teach parents it, when they watch me do it, they're like, "Oh, I see it." And we're like, "Yes, it doesn't have to be this like scary. There's so much information about oral play and how it can be aversive and how it can just damage the baby." Well, then you're doing it wrong.
Yeah.
Right? Like
Yeah. Right.
then that's all I can say because it shouldn't be. And it's a way to directly impact how the tongue is functioning. It's a way to directly see where we need to focus and if we need some support as a parent, like do we need to
Mhm.
bring them to someone to help them function, not just in feeding, because the tongue is responsible for, like I said, right? Digestion, it's responsible for regulation, it's responsible for the
Mhm.
way the palate and the face shapes. It's
Mhm.
responsible for draining the ears. Like it's got so much responsibility. Why would we not treat it with a little, some respect and give it some movement?
Right. And it's like Dr. Claire Staggs, it all starts here. Everything
Yes,
you're doing in
everything.
your body starts here, and your health span that you're setting your child up for life starts here.
Yes, yes. Why are we not engaging with it? Would be a
Right.
better question, you know?
Hmm.
Like if it's so important, why do we ignore it?
Right. Right. Because we didn't know.
Yeah, yeah.
Hmm.
Yeah, but also because people are telling you not to. Well, don't do that because
Right.
they're not gonna want to eat or they're gonna be scared or they're gonna have oral aversion. No,
No. Yeah.
no.
Yeah. That's not gonna happen. All
Yeah.
right. So I will put a link to that on there, but I'm also going to put a link to your habit tracker.
Oh, okay, great.
Yeah. So let's talk about that for just a few minutes. What is this and how is it
Yeah,
used?
yeah. So I actually use it. Um, and I created it because somebody was like, I just can't get in a routine. There's just no rhythm, and I know that the oral play helps. Like when I do it, I see
Mhm.
change in my baby. But I just can't get into a routine. And so habit stacking is really important for me. So I have 4 kids, 8 to 4 months old. Like it's chaos, and I totally get it. And
Yeah.
so like habit stacking is how I get these things in. Like we do nasal hygiene, oral activities every single day
Mhm.
with teeth brushing. That is what I have habit stacked it to. Everyone can agree that they brush their teeth, right? Like
Mhm.
nobody
Let's hope.
disagrees
Right.
with like that process. And so we all do it. So since we all do that, we're all in front of the mirror, we're always in the bathroom doing it. Let's habit stack it, meaning we're also going to have our nasal drops sitting next to the
Hmm.
toothbrush.
Okay.
Each kid has their own little name on it, right? So they know which one is theirs. And then we're going to have this habit tracker. And, as your kids get older, you're not in there with them brushing their teeth anymore, right? So like my oldest is 8. He goes into the bathroom, he does his routine, and he's checking off his stretches and oral activities himself. And the 6-year-old is getting better at it. The 4-year-old and the infant, I'm in the bathroom in
It's
front
still
of the
you.
mirror and we're doing it together. But you're in there with them brushing their teeth. So add 30 seconds, right? This is not meant to be a 30-minute activity. We are meant to be there, I mean, max maybe 3 minutes, right? So, well, 2 minutes brushing your teeth, so maybe five. You do your nasal drops is 10 seconds. And as they get better at the activities, it gets quicker.
Yeah.
They can start doing it themselves and it gets easier. But when you have an infant, like we're sitting in the mirror and I'm doing her activity, I would say I do it for like 60 seconds. Um, it also depends on what she is, right? Because if she's a little overtired, I might just go in, do a little quick thing, and then we're leaving. The key is
Hmm.
that we always are doing it because that's how you build habit, one, but that's also how you build the expectation that this is what we
It's
do.
what you do.
We brush teeth,
Right.
we do our nose, and we do our stretch because this is how we keep our body healthy. And as
Yep.
they get older too, you can start talking to them about, well, why do we do these stretches, right? Because our tongue needs to sit on the top of our mouth and we need to be relaxed in that space because our brain needs to feel good so that we can get
Hmm.
strong and you can start talking to them about it. They are very
Which
smart
is huge.
people.
Yes, yes. And then because they're going to want to be a part of it. And it's so
Yeah.
funny when I heard you talk about this the first time, and I think a lot of people do this, right? You try to relate to it. And I flash back to moments with my oldest, when she was 2 and 3 and 4, and you don't realize, I miss those moments every evening when we would go in together because it was just us. And she'd get on that stool and she's brushing her teeth and washing her face, and we're talking, and you look, it's actually such a precious, just little microcosm of your day,
Yes.
but she talked. So we could
Yeah.
talk about things. And I'm thinking, wow, if I had known about all this, we could have been talking about these things because she was so
Yeah.
relaxed and open,
Yes.
and it was not a big deal. And we're singing songs, and
Yes.
you make it enjoyable, then
Yes.
they're going to respond to it. And then now they're 8, 9, 10, and they're doing it on their own.
Correct. Yeah. It's not we're holding them down and we're like putting our
It's like,
hands
you
in
will
their
do
mouth.
this, because then
Yes,
they're not going to do it.
exactly. Then
Right.
they're
So
not
try
going
to
to do it.
enjoy it. It's five
Yes.
minutes. Go do it.
It's
Right.
just, and then of course you're going to have nights where they're like, no, no, right? That's
Right.
a toddler. I mean, a 15, 18-month old is like
They're
the
humans.
worst age. Goodness gracious, with their no, and they learn it, and you're like, but like then you come up with your strategies. Okay, well what song do you want to sing while we do our
Hmm.
stretches? Or what number do you want to count to? Because they just want that little piece of control, right?
They
Like
want
we're
control.
telling them
Yeah.
we have to do this, this, and this, and they're just trying to pull some control. So give them give
Hmm.
them an option. And like the point is like, well, we're
Just get
doing
them
it,
there. Hmm.
but how can we make this where you are understanding the importance, but also like not screaming because that defeats the whole purpose.
Right. And then they're stressed, and now you're stressed, and here we go
Yes,
again. Right. And now everybody's got to go get craniosacral, and
yes,
it's a circle.
exactly, exactly.
It's a circle. Let's not do that. So at the end of every episode, I always hand it back to you, our guest, because you are the expert. And I ask for your final thought that you want to leave our parents with.
Yeah, oh my gosh. We
I
talked
know
about a lot of stuff.
we
We
did.
talked
And
about
by
a
the way,
lot.
and I'll say it again, we talked about this much, and your Instagram is like this much.
Uh,
Please go check it out.
we talked about a lot of stuff. Um, I guess I always just want to stress like the mouth it just doesn't, it's so important and it can really change your child's whole trajectory of their life. And that's not even
Mhm.
like putting it mildly. Like you know, everything how they're regulated is so big, right? The tongue needs, I don't care what who else someone is saying, but the tongue needs to be up on the palate space with them breathing through their nose. Um,
Yeah.
but on the flip side, let's not become obsessive with it, right? so many parents like, or they're going to hear this and they're going to say, well, my baby's a mouth breather. It's going to impact their whole life. Yes. But here's these strategies that we're going to do. We're going to start to implement these things. It's going to take time, and that's okay.
Right.
We can only do what we can do, and we can only do with what the information we have, right? So we're not going to spiral because that can happen.
Yep.
And we're going to take these little tidbits. We're going to start watching our babies more. We're going to start incorporating these things because now we are aware of the importance of the mouth and how it can impact their life.
Hmm.
Um,
And that
but
was the biggest step to me.
yeah,
That's the biggest hurdle.
is the awareness part? It's like knowing,
Yeah.
right?
Once you
Yeah,
know it, and then you can either see it in your child and go, oh, mouth breather, got it.
yeah,
Or
got
you
it.
now understand it and you look at your child and go, nope, this one's okay. Let's just build on it.
Yes,
But
yes,
the knowing and understanding, that's the biggest hurdle.
yeah. And like, great. Now you have this information. I just so many times parents are messaging me. My baby's my 8-month-old is I just realized he's a mouth breather. He's been doing it his whole life, and it's just like going down this spiral of like all these things that now it's clicking. Like, oh, this is why he couldn't do this, and this is why he couldn't do this, and this is why he couldn't
Yeah.
do this. And
Every
I'm
parent will
like,
have that
okay,
moment.
first, it's okay. Like we are where we are right now.
Right. You can't go back. Here's where we
Uh,
are. How do we move
and we
forward?
can we can go forward, and we can go forward slowly, and it's not going
Mhm.
to be an overnight fix. It will not be an overnight
No,
fix.
no, that's the other thing. There's never an overnight
Yes.
fix for this. It is a
No.
process,
It's
no
a
matter
process
which
because
treatment you go with.
yes, you are training your body, you are unlearning their body to learn something new, and that's hard.
Yep,
That's hard. So,
I agree.
but there's things we're doing, and we're doing the best we can, and we love our children, and my kids will still like they'll be watching TV. Like, if you don't put your
Close
tongue
it.
where it's supposed to be.
Yep.
And they all have like devices. We call them devices in our family, and they're really just if anybody's familiar with the Myo Munchie.
I was about to say the Mayo Munchie. Yep. Just
So
walk
they're
around
they're
chewing on it.
dupes for the Myo Munchie. They're just toothbrushes, those U-shaped toothbrushes I
Yeah.
pop off, and put those in there in
Oh,
between
look
their
at you
teeth.
go. Yeah.
And I was like, go get your device because sometimes we as adults we need reminders, right? Like look how I'm sitting the whole time. Like
Yeah.
sit up, right?
I don't know
Like
how many times
it
a day I catch myself doing
you
this
catch
because it's
yourself,
just,
right?
it's more comfortable. Yeah.
So like your body goes into like path of least resistance. Yeah. It's like,
Right.
and so it takes time, and it's okay that they need reminders, and it's okay that you get in slumps, right? We'll just get right
Hmm.
back up, and we'll make it better. It's
Yep.
okay. That's
It
my
is okay.
message. It is
Just breathe.
okay.
Yeah.
Breathe.
Well, I can tell you it was an absolute delight to have you on. I'm so glad. I've been looking forward to this. So thank you for
Yes.
coming on and sharing so much. Really, really
And thank you for
appreciate it.
having me. Thank you.